Welcome to More Than Dentistry, where your hosts Evert and Waldo discuss life, dentistry, and everything in between with dentists around the world.
Hello and welcome to the More Than Dentistry podcast.
Well, thank you for the opportunity to have a chat with you today.
Absolutely. Happy to. I can barely hear. Oh, wait. I bet my speaker isn't turned up.
Okay, just test it again.
There we go.
If I can just introduce you, as your CV is Dr. Bethany Valachi. Am I saying that right?
Thanks for asking. It's Valachi.
Valachi. Okay. You are a physical therapist, a dental ergonomic consultant, and author of the book Practice Dentistry Pain-Free. You are also the CEO of Posturedontics, a company that provides research-based dental ergonomic education, and a clinical instructor of ergonomics at OHSU School of Dentistry in Portland, Oregon. You have delivered over 1,000 lectures internationally, including Dubai, Poland, Jamaica, Belgium, and Ireland. And you have written more than 80 articles in peer-reviewed dental journals, and you've also produced ergonomic and exercise videos specifically for dental professionals. You are staying in Portland, Oregon, and your husband, Keith, also operates a private dental practice.
Yeah.
Just explain to us, what is Posturedontics?
Yeah, so Posturedontics is a company that I developed after I married a dentist with severe low back pain. Okay. So I'm a doctor of physical therapy, and this kind of made my profession go in a whole new direction. I looked for someone to help him with his low back pain because I went on the internet and I found that this is a huge problem impacting thousands of dentists worldwide, and I could not find one person who specialized, actually did evidence-based ergonomics. I found a lot of hearsay and not evidence-based, but I figured this is something that really needs to happen. Evidence-based, unbiased education. So this is when I started doing the research. I did photogrammetric analysis and in hundreds of operatories and put the pieces together, and 20 years of research later, here I am. So this is all I've done for 20 years is research the problem of work-related pain in dentistry. So.
Okay. Your main focus is education, obviously, and you are at a dental school. How do they accommodate your field of expertise there, and how has that influenced the curriculum there?
Yeah, so that's a great question. Because there's so much time constraints in dental school curriculum, it was really challenging to even get an hour, of a few times a year into the students' curriculum. So it was kind of like pulling teeth. It was really difficult to get that time slot available. So now I have education for the first year, the second year, the third year, and the fourth year students, and every year it's different. First year, how to select the proper magnification that will prevent neck pain and not make it worse. Second year, we work on positioning with the typodonts, with the sim heads, and what clock position to be in for different tooth surfaces, how to position for upper versus lower arch to preserve the best working posture, and so on.
Okay, so let's just start off then with the first year thing about magnification. When we started practicing or started studying, we had no magnification. And just as we emerged, I'm now about 15 years in practice, magnification is massive, and I can understand why this is something in undergrad that has probably started. What is good magnification to start off with, and then the proper position? Because we've got fixed loops, we've got semi-adjustable loops, we've got microscopes. how does that influence our posture?
Yeah, this is a huge question. This was actually the focus of my doctorate studies, was dentists, neck pain, and magnification. So I could talk for an hour on this topic. So the research shows that working with the neck flexed forward greater than 20 degrees is significantly associated with neck pain. This requires dental loops with a very steep declination. And this is how steeply the scope angles down toward the oral cavity. So it's the most important factor, but unfortunately some of my students, so in general what I've found is that a 40-degree declination angle helps keep my students in that safe head working posture and prevents neck pain. Unfortunately, because my book also says 40 degrees of declination angle, and this is most of the manufacturers know that this is what I recommend. They all say our loops have 40-degree declination angle, but then oftentimes I'll go and measure my students and it wasn't a 40-degree declination angle. So this is why vertically adjustable flip-up loops are really the only way you can absolutely ensure that you're getting a steep enough declination angle, because you can adjust that declination angle down as steeply as you need it to in order to stay in that safe 0 to 20 degrees of neck flexion.
I've run through with magnification from all the way from the flip down loops that I would say the jewelers wear up until fixed loops, and then going to semi-adjustable and now on a microscope. And with everything, there's a little bit of an adjustment. But the one thing I saw as I was working with the microscope was I was over-flexing or overextending my neck for the first couple of months, and that was just as uncomfortable. And trying to learn myself to tilt at the hips, is that things that you also look at?
Yeah, so this really surprised me when I started my research, is that I received more requests for ergonomic consultations from endodontists who had neck pain than all other general practitioners combined. That blew me away, because I thought, my gosh, they have a microscope, right? When I started looking at this, I realized there's two factors that are causing this, and one is that most microscopes in their basic format are non-ergonomic. They do not have enough horizontal working distance to enable the user, the dentist, to sit upright. They have to lean forward. The other thing I found is that microscope users aren't properly educated in how to use the microscope, and that is that they tend to protrude the head, as you were talking about. They protrude the head forward to go to the binoculars when we really need to be palpating the suboccipital muscles. This is what I teach in my courses, and palpating these to relax these, and then once they're relaxed, then you can bring the binoculars to your eyes, maintaining the relaxed suboccipital.
What other sort of ergonomics does a dentist need to look after? His environment? What other things are you, how do you need to sit? And I mean, there's also a lot of guys that some guys try to sit on a like a bouncy ball or the saddle chair. Is there any benefit in sitting in these ways?
Yes, this is a loaded question, and I gave a 6-hour lecture on this, Waldo. So just to give you an idea of we're touching the very tip of the iceberg here. Regarding dental stools, the key here is to maintain a healthy lumbar curve. Now, if you are hyperlordotic or hypolordotic, those are going to be two different chairs for two different people. And so this is why I teach how to assess your lumbar curve. And then based on your lumbar curve, should you have a saddle type stool? Should you have a traditional type stool? But even more importantly, how should you tilt it? Should it be flat? For instance, someone with hyperlordosis, excessive curvature of the lumbar spine, I would not recommend a saddle stool for a typical saddle. And so, again, this is very kind of in-depth education. As far as delivery systems, these need to be at a proper height and distance so that the shoulder is not moving in a damaging movement, which is to the side and above elbow level. We want to be positioning. I've seen the most damaging postures with dentists and hygienists working on the upper arch.
Yes.
Okay, when they are contorting, trying to get a view, even with a mirror, right?
Yeah.
Trying to view like the distal buckle of number 15. So this is really important that where dentists are gaining control of the occlusal plane, and we can do this with proper patient positioning. And a lot of dentists were taught in school or by the manufacturer that they need to be positioning the patient differently with a double articulating headrest versus a flat headrest. And they need to be positioning the double articulating headrest differently for the upper arch versus the lower arch. And they have different, we can do many things to make the patient much more tolerant of being reclined. Because once we get the patient reclined, then the dentist can gain control of the occlusal plane, get that head back, and the dentist can sit in a more upright posture. So many things we can do here with patient positioning aids as well to provide cervical support and get that occlusal plane behind the vertical.
Is there a typical single biggest ergonomic related problem in an average practice that is easily addressed?
Yes, and that is probably that would be what we just talked about was non-ergonomic loops. I would say that is the main problem, at least in the United States. I see a lot, our biggest, I'm not going to say any names, but some of the biggest manufacturers make some of the most non-ergonomic loops that are causing extremely forward head, rounded postures that are causing neck pain. So we need to be very selective and know the 3 criteria for selecting truly ergonomic loops.
Okay, so it's not usually the most expensive loops or the best loops. It might be...
Oh, no. Yeah.
What positions should we pay attention to except for just neck flexion? Is there any other ergonomic things that we need to look at? What is your inclination of your legs hanging from your stool?
That's a great question. For most dentists, the thighs should be sloping down at about a 45-degree angle.
Yo, that's high.
Think of how steep that is.
Yes.
Most of the traditional stools that are sold, as part of a package with your dental equipment, most of them don't have that. It's a flat seat that tilts, right? And they don't have that capability to tilt that far, or you'd be on the floor, right? You'd slide right off the seat. So,
what's the reason to have that steep slope on that?
Yeah, that's a great question. So, you can discover this for yourself. Your listeners could discover this right now by placing their hand on their low back, on the middle of their low back. Sit all the way back in your seat and observe what you feel under your hand. And then keep your hand there and scoot to the edge of your seat So your thighs slope down, and now you feel what?
Yeah.
A curve, right?
Yes.
So this is education that's been a research that's been around for 15 years, but the manufacturers are still making, flat-seated chairs. Fortunately, they're tilting, but most of them don't tilt far enough now, which is why we have saddle stools have become popular, because you can only tilt a flat seat so far before you slide off.
Well, what can we do outside the practice to at least look at our own ergonomics to keep ourselves healthy, to practice longer?
Yeah, so outside the operatory, it's really important that you are addressing the muscle imbalances to which dentists are prone, because dentists and hygienists and that are prone to muscle imbalances unlike any other profession. So, for example, one imbalance that happens is the middle and lower trapezius muscles are your primary stabilizers. They have to be strong and trained for endurance if you're going to work all day with good posture in the operatory without pain. The problem in dentistry is that with only slightly forward head posture, these muscles become fatigued very quickly, and then other muscles have to take over and do a job they weren't designed to do, which is your upper trapezius. And most dentists will recognize that right away, that is a hot spot for pain and tightness and trigger points, and that is largely due to this imbalance. So a lot of exercises that aren't a problem for the general public are damaging for dental professionals. Things like vertical rows, military presses, or vertical rows, military presses, bench presses, things that strengthen muscles that are already short, tight, and ischemic can cause pain, which is why I developed an exercise program specifically for dental professionals, is to correct those imbalances.
Strong core is good for you. This is probably also something that would support the whole lumbar spine, because if we look at the core is not just the nice six pack, it's actually the whole trunk that we are should engage from the back muscles up to the abdominals. How important is that for someone that's sitting in a chair for the whole day?
Yeah, it's extremely important, Waldo. So we need to be targeting very specific stabilizers of the trunk with muscular endurance type training, not strength training. They're very different. Muscular endurance training is a lower level, high repetitions, unlike strength training, or weight training. So then we want to be very specific with the strengthening as well, because if you over strengthen rectus abdominis or the hip flexors, for instance, you're going to be really worsening a muscle imbalance to which dentists are already prone. So the rectus abdominis, when it gets shorter and tighter, just pulls the dentist into a more flattened back posture. So this was really common back in the 70s and 80s when sit-ups were considered to be a beneficial thing, and then we realized we were creating this whole generation of people with flattened lumbar spines and many disc herniations because they're over-strengthening rectus abdominis. And
so just having the balance between not just strengthening the front, let's say the one side, it is the balance between the two that will, and that's why it's the whole trunk that needs to be strengthened. It's not just the anterior or the posterior or the ventral or dorsal side.
True.
Okay.
Those muscles.
Okay. So let's say you are busy with a big long procedure. What is the best thing that before seeing the next patient, what type of stretches or things can they do to just release some of the tension that they've probably built up with all the concentration that they've had now?
Yeah, I would say stand up, deep breath in, stretch the arms up toward the ceiling and arch backward, looking up toward the ceiling, and the deep diaphragmatic breaths. We want to be addressing as many of the risk factors as possible in one short intervention. And as I teach in Module 2 of my online video training, the stress management is such a big contributor to physical pain in dentists that we need some very specific interventions that we can do to down-regulate the sympathetic nervous system in the operatory quickly to mitigate neck pain and low back pain that can result from chronic stress in the operatory. So just also implementing, this is just one example, that deep diaphragmatic breathing, because we know that the chest breathing worsens neck pain because it uses the accessory neck muscles that can also lead to more imbalance.
Yeah.
So,
but when we're talking about diaphragmatic breathing, we are talking about deep belly breathing. What is an easy way for someone that is not accustomed to breathe like that? How can they do that easily?
Okay, so they can do an exercise called it's a balloon breathing exercise. They can do this also with a straw. And in the, I gave you a link. It's
yes.
Posturedontics.com/bonus. In that, if they register, they will get my free ebook. They will get my balloon breathing exercise. They will learn how to do diaphragmatic breathing and implement that properly in the operatory to prevent neck pain, low back pain, and sacroiliac pain. And you get the white paper, 14 exercises dental professionals should avoid that can worsen pain. So just as an example, the diaphragmatic breathing, so it's difficult to do without a balloon. Let's see, you can simulate this by breathing out through tightly pursed lips. So you first find your transverse abdominals, and if you find these there's two little bony landmarks on the front of your hips, go one finger width above that, and then breathe in, pull navel to spine, and you should feel a strong contraction under your fingers.
Yeah.
Those are your transverse abdominals. So you want to monitor that while we're doing the diaphragmatic breathing. That is correct breathing. So you're breathing in through your nose, and then if you exhale through tightly pursed lips, you should feel those muscles tightly contract under your fingers. And that is, and so we do this by exhaling through a straw, through a balloon is best because it has a back pressure that studies show really helps train the intra-abdominal muscles. Okay, so.
Okay. Sure. Well, I mean, everybody's now got all these masks now that we need to wear. Do you think the N95 masks with the return valve, that is probably also going to influence our breathing a little bit? Do you see that people are probably going to be a little bit already engaging those trans-abdominal muscles if they breathe correctly? How do you think that's going to influence us in the long term?
Yeah, that's a great question. The breathing through the mask is probably going to be more difficult because unless you're trained properly, because when you're in the operatory, you naturally do a stress type shallow chest breathing, which is going to get less oxygen to the muscles. When the muscles get less oxygen, it initiates a sympathetic nervous system response, and that is that fight or flight response. So we got to get enough oxygen to the muscles. We can do that with deep diaphragmatic breathing. So knowing how to do this correctly, I think is going to be really important moving forward, wearing these, more PPE and thicker masks.
Yes.
Definitely. Yeah. It's a good question.
Do you think, some of the forms of PPE that they are suggesting about, let's say, hazmat suits or full surgical wear, is that's probably going to also influence our ergonomics in the long term?
Well, I think keep in mind that any barrier you put between yourself and the patient is going to cause you to flex and bend forward more, or you're going to have to reach forward more. Both are big risk factors for pain. So I think the more shields and that are going to, probably my biggest concern with the shield is it going to limit what type of loops that dentists can wear?
Yes.
Is it going to, how close is it going to be to the face? And if it, I can't imagine this because they're really, both flip-ups and through the lens are both very low profile. So I can't imagine that that would be an issue, but I don't know. Well, I don't think we've even seen maybe all the options yet that they're maybe coming on. I think we're just seeing the beginnings of what might come into the dental operatory in terms of protective gear. And we just have to see what comes and then address the ergonomics that result from it. But first and foremost, of course, is the dentist's health. So we've got to preventing, COVID-19 from spreading.
Yeah, what is your feeling around the whole situation that we have with do you think it is necessary? This is just a personal question. Do you think it's necessary for us to take all the measures of precautions? Or do you think that there is a middle ground where we can say, listen, this is something that we should have done a long time ago to prevent infection? Or is there things that we should maybe eliminate in the long term because this is probably going to do more harm than good? Let's say an N95 mask.
Well, yes, and yes. I think that there are things that we should have been probably doing before that could have, even mitigated some of the, flu viruses, just local little outbreaks, small outbreaks we've had in the past. I think people are being much more conscientious now with wiping things down but I think operatories, most operatories that I know are very good about this anyway.
Yes.
But even outside the operatory, especially is, I think is where a lot of people become very lax, is outside the operatory. So I don't think that right now in Portland, Oregon, we're still shut down. The restaurants are not even open yet.
Yeah.
And we are still wearing face masks into stores. And I think I very much agree with that right now. Until we, have more education, I think it's wise. Why not? Why? I don't know. I mean, why would you not do it if it's if it is helping, protect yourself and others? And until we really, really understand and have a grip on this thing, I think it's wise. And I think the restaurants, are going to start opening next week, and I would only go to ones that have 6 feet of seating apart from other people. So right now, so again, I think it's a real gradual reintroduction of a new way of life, perhaps.
Yes,
I don't know.
Yeah. Yeah, I mean, we are now on a level 4. We are also easing out into level 3 next week, where we had a very aggressive lockdown where things were very shut down. We could only see emergencies, but dental practices have been open now for the last month. But the amount of work that could have done was also limited, especially what they considered aerosol generating procedures. But now things looks like we are moving into a new season, and hopefully just starting to a certain extent a little bit of more normalcy. The one thing that is quite I think what's quite positive for me was that the enforcement of almost working always with high volume evacuation and a rubber dam, which was not always considered to be a standard practice. And the one thing that I enjoy about working in under rubber dam is that you're only focused in one area, and this is actually making the procedure a little bit faster in the long run. Do you think that should also cover under something like ergonomics, where you're actually clearing your field of view so that you can actually concentrate better and work better?
Well, definitely. I think things like the isolite, I don't know if you're familiar with those.
Yes,
Are
yes.
those sold in here? Okay. So the isolite addresses multiple ergonomic factors, and the rubber dam, I think, is going to be very, very important coming up here to prevent a lot of spread.
Yeah.
And so there's the dry shield and the isolite, and just using a rubber dam with the HVE. Those are going to be very important, I think.
Yeah. If there's one strategy that a dentist can do tomorrow in his practice that it's going to set him up for better ergonomics in the long term and hopefully save him from, that's probably a stat that we haven't even come to, how many early retirements we have because of musculoskeletal problems. What is that one strategy that he or she can employ to get them into a better dental practice in the long term?
Oh, that's such a loaded question, Waldo. One thing.
Okay, well, you can make 2, 3, it doesn't matter.
One thing they could do is download my free ebook. Seriously, because that is one thing, and they have much information there.
Fantastic.
So, but one thing that they could do would be to, there's so many, everything we've talked about is equally as important.
Yeah.
The loop declination angle is important. The down-regulating the sympathetic nervous system, making sure the thighs are sloping steeply downward, proximity to the patient. These are all, I can't really say one is more important than the other, because they are all so intertwined and combine to lead to poor, damaging postures, and can gain control of the occlusal plane. So working in the correct clock position. So
I think maybe the one thing that we need to have is actually just being cognizant of the fact that these things are really important in the way that we are treating our patients. That our body posture is extremely important.
Right. And I would say one thing that I would really suggest for people, for dentists, is to, when you're looking for solutions for your work-related pain, make sure it's evidence-based. based. If someone is saying this chair is ergonomic, ask for the research. Okay, because it is a dog-eat-dog market out there, and dentists, just as you require, the evidence to effectively your patients, you need to also apply that to your ergonomics, and you need to employ education that is going to address the etiology of work-related pain, not just do a shotgun approach. Here, try this stool, try this personal trainer. One of the most common mistakes I see dentists make is to hire a personal trainer or go to the gym to resolve pain, and then they're doing exercises that aren't a problem for the general public, but it throws them into the vicious pain cycle and they don't understand why. So,
Okay. Where can people get in touch with you?
They can get in touch with me at posturedontics.com.
Okay.
Posture, like how you said,
Yes.
dontics, like endodontics, .com, and I'm offering I have a free ebook.
Yes.
I have the white paper, 14 exercises that can decrease, or 14 exercises dentists should avoid that can worsen your pain, and then that deep diaphragmatic breathing exercise. A video of that is all available at the posturedontics.com /bonus, BONUS. And yeah, that gets you started down the right evidence-based education to start effectively resolving work-related pain in dentistry, because it can be done.
Yes.
It's just that most dentists weren't taught how to do this in dental school.
Yeah. You mentioned something about the online course. How is your online course structured, and what do you cover?
Yes. So in my online course, this is called the Well Body System for Dental Professionals. It is 5 modules of education, 10 CE credits, and the first module is all on dental ergonomics. We know that, and it's a stepwise progression, because first we need to be resolving ergonomic issues in the operatory, otherwise you're kind of spinning your wheels. So the first module, lesson 1, is dental stools and low back pain. First module, second lesson, is on dental loops and neck pain and therapies for neck pain. Module 1, lesson 3 is all on positioning of the operator, the patient, the headrest, the patient chair, what clock position to be in, all those things. Module 2 is how to downregulate the sympathetic nervous system, that fight or flight response, to reduce pain. That's an hour-long module. Module 3, I just finished this last week, is treat and beat your myofascial pain, where I show what healthcare specialists are the best ones to help you resolve some of these myofascial problems. And I also teach you the 7 key trigger points that dental professionals are prone to, and how to self-treat those so you can take control of your own pain. Module 4 is chairside stretching, the 20 essential chairside stretches. Module 5 is the home exercise program that I specifically developed for dental professionals.
Wow, that
and that
sounds
is
fantastic.
at the posturedontics.com /wellbody.
Okay, awesome. Well, I hope when we have flights that are international, we can at some stage see you in South Africa at a congress.
I'd love to come to South Africa and share this education. Waldo, thank you.
Yeah. Thank you for your time.
Thanks so much for having me. It's been a pleasure.
Okay.
Take care.
You too. Okay, bye.
Thank you.